Mike here, Oak Brook Medical Group in Oak Brook, Illinois. Got my handy dandy spine here. We're going to talk about sciatica. It's running rampant right now. I don't know if everyone's bringing out the Christmas decorations or what's going on, but a lot of lifting, a lot of sciatica type pain. So here's the deal. Sciatica kind of gets, I don't want to say misdiagnosed, but people say that everything with low back pain that goes into glute sciatica, and that's not necessarily true. So the sciatic nerve, I want you guys to understand what this is the sciatic nerve starts with 4 nerves. It starts right here, L4, L5, L5S1, and then S1 and S2. So those 4 nerves come together and make the really thick sciatic nerve, and it actually runs right down there through the pelvis into the legs. So here's the deal. We need to distinguish sciatica from piriformis syndrome. 2 different things that can give you the same type of symptomatology. So again, one of these things, this is why we do the exams that we do the x-rays, we do the evaluations, because we really got to nail these diagnoses, because it's going to help you guys get better faster, okay? So when we're dealing with sciatica type pain, we know it's stemming from the low back. You're going to have that pain that runs down through the glute, down the legs, and it's going to go all the way into the toes. That's how we know typically we are dealing with sciatica, and it's going to be stemming from that low back. However, we've also had patients, and you may be dealing with this, that say, hey, I've got sciatica, I've got this pain, numbness and tingling that goes down through my glute into my hamstring, and then it stops at my hamstring. It never crosses below the knee. If you're dealing with that, typically that's more of a piriformis syndrome issue. So that sciatic nerve comes out, and like I said, runs right underneath the glutes here. The piriformis muscle connects out here into the hip, into that sacrum. But when the piriformis muscle gets tight, it can press against that sciatic nerve. So it gives you that same sensation, the same symptomatology, but it's only because that muscle's tight. So really what we got to do is loosen that guy up, and then the patient's going to start to feel better quickly. So here's the deal. Like I said, when we're dealing with the sciatica, we really got to evaluate you guys. We got to do the exam. That's why we make sure that everything's comprehensive in the office. Everything we do is results driven when it comes to our patients. We got to get you guys better faster, but also teach you what you have to do to make sure that you hold on to those results for a lifetime. We got to get you feeling better and functioning better. So if you're dealing with sciatica, you know anybody that's dealing with sciatica, give us a call at that number below. Let's go through that evaluation. Let's take some x-rays if we need to take some x-rays, get you feeling better and get you on the right path. We'll see you guys in the next video.